Welcome everyone once again. I'm Ashley Camilo, personal fitness trainer. Today at Fit and Healthy by Ashley, we are very happy to welcome a new member, Daniela Garcia. In summary of her general profile, she's 26 years old, she's a middle school teacher, so sometimes suffers period of anxiety and excessive stress. She doesn't smoke and only drink alcohol occasionally. She suffers low back pain. In addition to that, she doesn't present any musculoskeletal injury nor any risk factor that prevent her from performing exercise. Her current level of physical activity is partial since a few months ago she began to walk and jog during the afternoons of 4 days a week. Her main goal is to lower the percentage of fat in her body. She has requested my services as a personal training to guide and educate her in the field of exercise so she can achieve her goal. We will begin the periodization by the phase 1, stabilization endurance training, since she has not exercised before. The focus of this first month of training is to maximize the level of stabilization, strength, and postural control through the correct execution of the exercise select for her. I will work with her under the parameter of training for the population with low back pain 3 times a week. Among the exercise I have selected for her are number 1, dumbbell lateral raise for the upper body. Number 2, leg extension in a commercial machine for lower body. And number 3, isometric lion alternating Superman for core. The purpose of this exercise is first, to help her to improve her movement technique and prevent injuries. Second, it's help her to develop muscle and improve strength in specific areas of her body. Lateral raise is an isolation exercise which works the medial deltoid with the help of both middle and lower trapezius, serratus anterior, supraspinatus, infraspinatus, teres minor, subscapularis, pectoralis major, lower fiber, and latissimus dorsi. Each of these muscles has a specific and different work allows successful shoulder abduction in frontal plane. Third, sit, hold the head of the humerus in the glenoid fossa, acting synergistically to allow the medial deltoid to do the action of shoulder abduction, acting as an agonist in the concentric phase of exercise. Then, the trapezius middle and lower fiber and serratus anterior join to act synergistically to second phase of shoulder abduction in the frontal plane, allowing an isometric pause before continuing with the eccentric phase. Finally, the inferior fiber of the pectoralis major and the latissimus dorsi together with the medial deltoid and the exercise in its eccentrical phase decelerates the shoulder abduction movement. Some mistakes that should not be made when performing this exercise. For example, in the preparation phase, the shoulders are not at the same level. The right shoulder is too high or lower than the left prior to movement. Another common mistake is that the correct alignment of the arm is not maintained, and they are brought forward in the sagittal plane, rather than maintaining the execution of the movement in the frontal plane. So, we start by making sure of 4 points of posture and the retraction of scapula. By maintaining the retraction, we define the range of motion when the weight is raising toward the central face. In the central phase, the glenohumeral joint abduction in relation to the body creates an angle can range from 45 to 80 degrees based on amount of the glenohumeral misalignment. We hold for 1 or 2 seconds. We make sure to continue with the correct posture before movement on the next phase of the movement. In the terminal phase, we continue with shoulder adduction slowly and smoothly. To ensure that Daniela is performing the movement correctly, I must palpate the middle fiber of the deltoid. Also, after each training session, I will use the point sheet of evaluation and personal trainer's observation plan to keep track of her progress and determine the right time to continue with other more complex exercises. 2 other exercises that we will be working on for the upper body area in this first phase are the seated back row in a commercial machine and the seated chest press. Leg extension is an isolated exercise that focuses on the muscle of the quadriceps, vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. Other muscles that are involved in the execution of movement are the hip flexors, psoas major, iliac, desertorium, as well as knee flexor, femoral biceps, semimembranosus, semitendinosus, and the popliteus. Each of these muscles has a specific and different work allows successful knee extension in sagittal plane. First, the quadriceps do the action of knee extension, acting as agonist in the concentric phase of exercise. Then, the hip flexor and knee flexor act as antagonists and allow the isometric phase of the movement before continuing with the eccentric phase. Finally, the hip flexors and the knee flexor, together with the quadriceps and the exercise in its eccentric phase, decelerates the knee flexion movement. I advance some mistakes that should not be made when performing this exercise. For example, posture lock not maintained during all phases. Another common mistake is the subject extend the knee too far based on the seated angle. So, we start by making sure of 4 posture points and vertical alignment of ear, shoulder, and hip. Also, posture alignment has shoulder lever retract prior to movement. The glenohumeral joint maintaining a level and balanced position going from preparatory to central phase. In the central phase, leg extended to a height that has the quad contracting through range of motion and angle of sit. We hold for 1 or 2 seconds. We make sure to continue with the correct posture before moving on to the next phase of movement. In the terminal phase, we continue with leg flexion slowly and smoothly. Once we get back to our starting position, we repeat each step again for a 12 or 15 repetitions. To ensure that Daniela is performing the movement correctly, I must palpate the top of the quadriceps muscle group, the medial aspect, and the lateral aspect. Also, after each training session, I will use the point sheet of evaluation and personal trainer's observation plan to keep track of her progress and determine the right time to continue with other more complex exercises. 2 other exercises that we will be working on for the lower area in this first phase are the leg curl and body weight squat. The alternate Superman is a strange exercise that is performed in a prone position on the ground. Movement involves alternating elevation of the contralateral arm and leg. This exercise focuses on strengthening the muscle of the lower back and buttocks. The alternating Superman agonist muscle is the erector of the spine, while the antagonist muscle are the psoas major, the iliac, the sartorius, and the rectus femoris. Due to Daniela's individual needs and the goal set for this month, she will be doing this exercise isometrically. It means that instead of performing several repetitions per side, she will hold the movement for a stipulated number of seconds before moving on to the next side. I advance some mistakes that should not be made when performing this exercise. For example, bend the elbow and knee. Another common mistake is pointing to the foot. While it may be a natural thing during this exercise, this will remove focus from your core and distribute it to your leg. So, we will start by lying on the floor with arms stretched above the head, by making sure of forward posture point and the retraction of the scapula. In the central phase, we will raise our right arm along with our left leg 5 to 6 inches off the ground. We hold the position for 30 seconds to 1 minute, and we make sure to continue with the correct posture before moving on to the next phase of the movement. In the terminal phase, we will lower the extremity slowly and smoothly. Once we get back to our starting position, we repeat each step again with another side. To ensure that Daniela is performing the movement correctly, I must palpate through spinal erector. Once again, also after each training session, I will use the point sheet of evaluation and personal trainer's observation plan to keep track of her progress and determine the right time to continue with other more complex exercises. Two other exercises that we will be working on for the core area in this first phase are the bird dog and the back extension in a Roman chair. For me, it's a pleasure to take Daniela by the hand and guide her on this new path she was just undertaken. My main goal for Daniela is to learn and master the correct performance of each of the exercises selected in this first phase. Therefore, we will be performing 3 sets of 12 to 15 repetitions for each exercise, since the more practice, the greater neurological stimuli is received. In conclusion, greater adaptation and mastery of movement. In addition to the 3 scheduled training sessions, Daniela will be doing 30 minutes of different cardiovascular activity 4 times weekly. So, no more to say. Let's go to the map.